the dawn's early light, what so proudly we hailed at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight o'er the ramparts we watched were so gallantly streaming, and the rockets' red glare, the bombs bursting in air, gave proof through the night that our flag was still there. Oh, say does that star-spangled banner yet wave o'er the land of the free and the home of the brave.
Now, approaching the podium is the Executive Director of the National Governors Association, Bill McBride.
Good morning. On behalf of all of us here at the National Governors Association, a very warm welcome to all of you. We're so excited that so many people are with us today. As we all know, our chair, Governor Phil Murphy's decision to focus on youth mental health for his chair's initiative is extremely timely. Rates of mental health challenges among young people have been climbing for years, even before the pandemic. In 2019, the American Academy of Pediatrics reported that mental health disorders have surpassed physical conditions as the most common issues affecting adolescents. Since the start of the pandemic, the situation has only grown more serious. The statistics surrounding the increase in mental health disorders are concerning. At the same time, we know Americans around the country are working to raise awareness and find solutions to the problem. A number of experts who are leading these efforts are gathered for the discussion today, and we look forward to hearing from these leaders. Once again, thank you again for joining us. Your participation will help further the work of Governor Murphy's initiative and in turn help more young people in our country. So please join me in welcoming the National Association Chair, New Jersey's Governor, Phil Murphy.
Good morning. A little bit trepidatious to follow that national anthem, by the way. Let's hear it one more time for God Bless America. Thank you, Bill, and welcome to the 115th gathering of the National Governors Association Winter Meeting, which is officially called to order. Thank you all so much for joining us today to explore solutions to strengthen youth mental health. This is an issue that transcends both state and party lines. I chose strengthening youth mental health as the focus of my chair's initiative in hopes of uniting governors, and we have, I'm happy to say, from red and blue states alike, in a nationwide push to increase awareness and support. And frankly, I've been blown away by the response. Everyone seems to recognize how serious, how important this is. And people are coming together. Parents, physicians, educators, policymakers, elected officials, on, to figure this out. And I'm very encouraged by the progress that we've made so far. And I want to thank in the leadership and support of the NGA Vice Chair, Utah Governor Spencer Cox. He's a huge part of that. Governor Cox and First Lady Abby Cox were kind enough to host us for our kickoff, our first roundtable last fall in Salt Lake City. And the momentum has only grown from there. Gavin and Jennifer Siebel Newsom hosted us in Santa Monica a couple of weeks ago, and we continue to plow through this. Under Governor Cox's leadership, Utah has launched some innovative policies, like, which is something I love, the Safe UT app that empowers young people to seek help. And I am happy to welcome him to share more details on that and Utah's other proactive policies. Please help me welcome a dear friend and a great leader, the governor of the great state of Utah, Spencer Cox.
Ladies and gentlemen, it's great to see all of you here today. I'm so fortunate to be able to spend some time with you this morning. I will be brief. I just want to begin by thanking Governor Murthy and his amazing wife, the First Lady of New Jersey, Tammy, for their incredible work in this space. They are making a difference, and this is an example to the nation of how Republicans and Democrats can work together on the most critical issues. As we've been reflecting and working on this issue for so many years in the state of Utah, and I want to just give a shout out, a thanks to all of our partners who have joined together, again, Republicans and Democrats working on this. Like many of you, we have had record funding coming out of our legislature to help with these issues. And by focusing on the youth piece of this, I think it's so important. I do not know a family who has not been directly impacted by mental health issues amongst their youth. That's a big change from when I was growing up. If nothing else, the discussion that we're working on, and there are many other things, don't get me wrong, but if we can change the stigma around mental health with our youth, we will have been successful. Just on a personal note, as a young person growing up, my parents got divorced when I was 10. I really struggled. The first week of middle school, I got put in a trash can in the middle of a hallway as all the other students were walking by. Some of the bullying that went on, those were tough times, and it got very dark for me. There was a period in my life when I thought the world would be a better place if I was not there. And I'm so grateful for the adults in my life, the people I was able to talk to, communicate with, who believed in me. These were teachers, these were church leaders, and of course these were family members. And their belief, seeing something in me that I didn't see in myself, kept me here. And never imagined the amazing life that I would have as an 11 and 12-year-old kid who was pretty screwed up at the time. And I'm so grateful I stayed. And we need these kids to stay. They have the ability to make the world a better place, to change the world, but they need to know that it's okay to feel these things. They sometimes think they're broken because they feel like they're the only ones. I know I felt that way, and that's not true. These feelings, these thoughts are much more common than we understand, and just knowing that piece, that you're not alone, can have a tremendous impact. And so again, as we work to break the stigma, I do just want to mention the Safe UT app. I would love you to download it, look at it, check it out. It's an incredible application that we created a few years ago in conjunction with the University of Utah, with their mental health resources there. At the push of a button, any student in the state of Utah will immediately be in contact with a mental health professional. And they can do that anonymously if they prefer, or they can be, they can give their identity and have a conversation with that mental health professional. We know we have saved lives. We have many stories. I don't have time to share them with you today. We have saved lives. I will also tell you there is another piece to this app where they can report someone else who is having suicidal thoughts, suicidal ideations, or suicide attempts. They can also report, again, anonymously if they prefer, any other type of dangerous activity that is happening in their school. We've prevented several school shootings because of the Safe UT app. We've been able to intercept guns at doors going into schools because kids knew and had an opportunity and ability to communicate with adults in their school directly to let them know that something was happening. So it's an incredible resource. resource, one we would like to see expanded throughout the nation. I'm really proud, as I'll just end, that the 988 service, which is now available nationwide, actually started in Utah. That was an idea we had that we floated to our state legislature. We tried to do it and realized we couldn't do it. We had to get the FCC involved, and so we thought, well, let's take it to Congress and see if we can't get that done. And we're so proud that we're finally able to get that over the finish line, and that we are making a difference. So again, thank you to the Murphys for their amazing leadership in bringing us all together on this issue, and I look forward to the discussion today. Thank you.
Until I met Spencer, I used to think that all good things started only in New Jersey. And I now realize Utah is also the source of a lot of really good stuff. Thank you, Spencer. And thank you for sharing your childhood challenges. And to you and Abby, we are so grateful to have you as partners in this cause. As the governor said, this issue for so many of us is personal. It's personal to us as parents, and it's personal to us as kids ourselves and as policymakers. As leaders, one of the most important and sacred responsibilities is protecting the health and well-being of our kids. And for far too long, mental health and well-being of our young people has been overlooked. And the consequences are impossible to miss. From small towns to big cities, America's youth mental health crisis is playing out in homes, schools, hospitals, and beyond. Young people who are afraid to get help or don't even know where to turn to, go to YouTube or TikTok for help. Parents seeking treatment for struggling children face long wait lists for an appointment, if there even is a pediatric therapist in their area. School counselors are swamped, even emergency rooms are overwhelmed. At every level, the system is strained by unprecedented rates of mental health challenges among our kids, an existing trend supercharged by the pandemic. The CDC calls its data on youth depression and anxiety, and I quote them, a cry for help. Most troubling of all, suicide is now the second leading cause of death for 10 to 24-year-olds in our country. And this moment, therefore, requires an all-hands-on-deck approach. No single state, by any means, has all the answers, and no part of the system can solve the issue alone. Schools, doctors' offices, hospitals, counselors, they are all part of the solution, and they all need our support. So we're visiting multiple states for roundtable discussions that bring experts to the table to share their lived experience. Parents, physicians, pediatric psychologists, educators, policymakers, community leaders, nonprofits, and most importantly, young people themselves. There are so many interrelated factors that contribute to mental health challenges and so many interrelated barriers to care. It's an endeavor that calls for a holistic approach. So we're methodically working our way through 4 pillars. Our first roundtable in Salt Lake City, hosted by Spencer and Abby Cox, focused on the first pillar, prevention and resilience building. Our second event last month in California, hosted by the Newsoms, concentrated on the second pillar, increasing awareness and at the same time reducing stigma. Again, special thanks to both Team Cox and Team Newsom for hosting those fantastic events, and I want to give Colorado Governor Jared Polis a shout out for joining us in Santa Monica. At 2 more roundtable events in additional states, we'll focus on the final 2 pillars, ensuring access and affordability of quality treatment and care, and then finally training and supporting caregivers and teachers. I'm pleased to announce, and I want to thank Gretchen Whitmer personally for this, that our next roundtable will be in Detroit, Michigan, in the Motor City, April 19, 20, and 21. And again, I thank the governor for hosting us so graciously. And If that weren't enough, my wife, Tammy Murphy, stand up and take a bow, please. Tammy Murphy. I don't want Laura Kelly to get mad at me, but Josh Shapiro is not here because he's at the Super Bowl rooting for his Eagles. We'll leave that to John Carney. And Laura, I'm not. This is not a. It's just a statement of fact. It's a statement of fact. Laura, may I say this? Go Chiefs. Okay. Josh is likely to host us for a single day, sort of interregnum convening in Philadelphia, sometime probably in May. And Tammy and I cannot wait to welcome everybody to the great Garden State, New Jersey, in July 12 to 14, for our NGA annual summer meeting. And that will be in Atlantic City. As I've said to many of you, bring your dancing shoes and your wallets. Not necessarily in that order. The roundtables also examine our parallel initiative, and I want to thank Tammy for this, on maternal and infant health. She has done outstanding work on this issue in our state, and she's doing an excellent job leading this initiative nationally. So these two initiatives share so much common ground, like the challenges to affordable and accessible care, the importance of coordinated solutions, and our duty to our most vulnerable. It makes sense that we consider them together and develop shared solutions that give kids in our states the support they need and deserve to get the best start in life. And we've learned already so much from these roundtables. Hearing personal stories, learning more about root causes, visiting schools and organizations who are succeeding with innovative, compassionate solutions, exploring obstacles to care. These roundtables have expanded our perspectives exponentially, and I'm so grateful to those who have shared their knowledge, including our panel today. So it's our plan to assemble all of these findings and best practices into a playbook that states can take off the shelf and find real solutions that they can make on their own. And there's good reason for hope. Everywhere we go, it's clear that governors from both sides of the aisle are stepping up to the challenge. As we mentioned, Governor Cox is championing the innovative app that meets students where they live, their phones. State after state is implementing similar services, with many requiring student ID cards to include a crisis text line or suicide prevention hotline. I mentioned Governor Gavin Newsom. He's applying the kind of all of the above approach we need. His administration's $4.7 billion master plan for kids' mental health will transform the youth mental health infrastructure, adding 40,000 new mental health workers in the state, increasing the number of school counselors, and addressing stigma head on. In Ohio, Governor Mike DeWine launched a program called Ohio Resilience through Integrated Systems and Excellence, or Ohio Rise. Nearly 5,500 kids and youth now have access to Ohio Rise, which works through Medicaid to remove silos and provide specialized managed care behavioral services for young people with the most complex needs. And I want to thank, in absentia, Mike's had sadly a death in his family. Keep him in your prayers. I want to thank him in absentia for his leadership. I mentioned Colorado Governor Jared Polis. He's working on bipartisan policies to improve the behavioral health system and give young people the tools they deserve to help manage their mental health, including through the innovative imattercolorado.org, which offers 6 free mental health consultations for students. And I thank you, Jared, for your work. Doug Burgum is here, I think. Doug, he and his wife, First Lady, and Tammy and I have spoken about the Native American challenges, which are explicit and among the most challenging challenges we have in our nation. In our state, in New Jersey, we're aiming for a comprehensive approach to connect kids with mental health and behavioral health care while empowering parents and educators to provide support through New Jersey's children's system of care. So, to begin closing the gap in our state, at least, between the number of providers and the number of New Jerseyans in need, we've launched a student loan redemption program as an incentive for certified behavioral health professionals to serve our communities. And with community feedback, we're getting smarter about how we approach every angle of the system, including, by the way, something we launched last week statewide, something we call Arrive Together, which pairs a law enforcement officer with a mental health professional to go out in an unmarked car with no uniforms to respond to individuals experiencing a behavioral health crisis. We've piloted it, it works, and we're now going to expand it to the entire state. So all of our state's efforts are backed by strong federal support through COVID relief funds and legislation like the bipartisan Safer Communities Act. Congress and the White House have committed significant resources to priorities like increasing the number of school counselors, ensuring kids can access mental health care, including telehealth options through Medicaid, training primary care physicians in mental health care fundamentals, expanding after-school and summer activities, and supporting community clinics, and so much more. So as we kick off a new Congress and a new year, it's vital that Washington policymakers maintain these essential commitments. Every single child deserves to have their mental health supported. And through the initiative to strengthen youth mental health, governors from around the country are committed to ensuring that the young people in our states and every state can access the mental health support they need to thrive. And I'm so grateful to everybody out there for all of your support for this urgent priority. And you all have stepped up in such a big way, and I look forward to an insightful conversation today. And I know you're looking forward to the panel as much as I am. So to lead the conversation, I'm thrilled to be joined by Dr. Alfiee Breland-Noble. Dr. Alfiee is a pioneering psychologist, scientist, author, and founder of the mental health nonprofit, the AAKOMA Project, which works to build the consciousness of youth of color and their caregivers on the recognition and importance of mental health, empowering them to seek help. She also hosts the video podcast, Couched in Color, with Dr. Alfiee. And we are so pleased to have her with us today. She will introduce our rockin' panelists. Please help me welcome Dr. Alfiee Breland-Noble. Thank you so much for doing this.
I appreciate this. So I'm going to go ahead and take my seat. All right, so I have a mic on so I can take my seat. How are you all? You that good? We're going to try again. How are you all?
We're great.
Thank you, thank you. So it's my honor and pleasure to be here. I want to start off by introducing the amazing panel we have up here. Just as the governor said, this rocking panel. Can we give them a round of applause, please? Fantastic. So of course we're going to start with our fabulous chair, New Jersey Governor Murthy, First Lady Tammy Murthy. We're going to move on to Dr. Richard Besser, President and CEO of the Robert Wood Johnson Foundation. Our honored guest, Reina Chiang, our young person who's going to educate all of us and help us get our minds right about what our young people are experiencing. One of the single most important voices we have to hear are the voices of people like Ms. Chiang. And so we're so honored to have her. And absolutely, absolutely. And of course, last but definitely not least, who has to depart from us a little early today, so we're going to make sure we start with him, and that is our beloved Surgeon General, Dr. Vivek Murthy. So we're so happy to have our panelists. Thank you all for being here. Dr. Murthy, because we know you have to leave, Dr. Murthy, we want to start with you. And I would love to just ask you, I have to tell you, I'm really excited about the advisory that you released. It was just, I can't tell you how much it meant to me as a person who spent their life doing this work, so I really want to honor you for that. We really appreciate it. And in 2021, you released this advisory on protecting youth mental health. Can you share with us a little bit about how your advisory relates to the priorities that the governor has shared with us for his initiative, and then follow that up with what results have you seen at the federal and state level that you feel have been most impressive?
Well, thank you so much for that, and what a wonderful experience to be here with all of you. an honor to certainly be here at a time where youth mental health is center of our focus, and that's thanks to Governor Murphy and our First Lady of New Jersey, who have really put this on the map as the key issue that it is. I just want to say, just on a personal note, to echo something that Governor Cox and Governor Murphy both said, which is that to all of us, this is a very personal issue. If we haven't been impacted by mental health concerns, we know people who have been. Maybe our children have been as well. And like many kids who are growing up today, when I was a child, I also experienced my share of struggles with my own mental health. The difference was I didn't know who to talk to about it. I didn't know what it meant. I thought that my own struggles were evidence that something was wrong with me, that I was broken, insufficient in some way, and I carried a profound sense of shame around with me for years because of those struggles. And too many kids are in the same position today. The reason in 2021 December that I issued the first Surgeon General's advisory on youth mental health was because it truly is a crisis in our country. 57% increase in the suicide rate in the decade prior to the pandemic among kids. It takes 11 years on average from when a child has symptoms to when they actually get care in the United States of America, which is not acceptable. And we have nearly half of high school students in America right now who are saying they feel persistently sad and hopeless. But what we laid out in that advisory is very much in line with what Governor Murphy has talked about as key strategic directions we have to move in, which is to invest in prevention, to expand access to treatment, to increase the size of our mental health workforce, and to reduce the terrible shame and stigma that surround mental health and well-being. And the good news is that we are making progress. There's a lot more work to do, but I have never, in the nearly 30 years that I've spent in public health, seen the kind of alignment and momentum around addressing mental health concerns that we have right now. So if you look even at a state level, we've talked about the Safe UT app that Governor Cox and his colleagues have helped to spearhead in Utah. My understanding is in 2022 alone, there were more than 300 life-saving calls that were enabled by that application, which is extraordinary. In Ohio, when I visited the Children's Hospital in Columbus, I learned about the incredible partnership that they are building with schools in communities to actually help fund the kind of prevention programs that we know work, like the Good Behavior Games and other school-based prevention programs. But in Massachusetts, we've seen the use of technology also in ways that have increased access to care, telemedicine specifically through the Pediatric Mental Health Access Program. And in many states around the country, we are seeing a growing number of partnerships between schools and healthcare systems. We're seeing that, for example, in New York, where in Long Island, Northwell Health paired up with a number of school districts to help reduce the wait times for kids so they could get easier access to care, and so that kids wouldn't have to experience what too many do today, which is having to wait for months and months and months before they got care. I'll lastly just say this as a parent of a 5- and 6-year-old. There are a lot of different types of pain we can experience in life, but I think one of the worst types of pain is to be a parent seeing your child suffering and to not be able to get them help. And that is a circumstance that too many Americans find themselves in today. And that's why it's so important that we launch and sustain and expand these efforts to get care to people, to invest in prevention, because this is about human suffering, an unimaginable amount of human suffering that's taking place right now. But we have the tools, we have the collective will, we have the knowledge to prevent that, and that's what we're all here to do.
Thank you so much. I really appreciate those comments, and yes, thank you. And one thing I want to echo is just pick up on this theme, and I'm going to turn to you, Governor Murphy, to talk about your initiative. Something that you mentioned that really stands out to me is the idea that all parents and caregivers, right, want to be able to help their young people when they're struggling. So the importance of recognizing, with the beautiful diversity that we have on this panel, all of our young people need something that you've mentioned, culturally relevant, culturally competent care. So I just appreciate your remarks, and thank you so much for being here with us. We really appreciate it. All right, so Governor Murphy, I'm going to turn to you. I would love to hear a little bit about you being halfway through this initiative. You've hosted multiple events, as you've mentioned, around the first two pillars, of prevention and resilience, something that's really important to me and us at the AAKOMA project, as well as reducing stigma and increasing awareness. I will dive in a little bit and say the 3 pillars of the AAKOMA project echo nicely, right? So we're all about raising consciousness, empowering people, and changing the system of mental health, which really dovetails nicely with what you've been able to do. So can you share a little bit about what you've learned so far and what you found most surprising in this year of your initiative?
First of all, I said this to you privately, you rock. I'm
Thank
a
you.
huge fan.
Thank you. Thank you.
And secondly, Vivek is not leaving because he's got another engagement. He's got to attend a funeral of a dear friend.
We're sorry.
General, thank you so much. You're
Yes.
you're a very close and dear friend of ours, and thank you so much for coming by. And obviously, you're in our prayers.
Yes.
I tell you, we're halfway through the journey, as you rightfully point out. The AAKOMA project, in so many respects, is a
Yes.
guiding
Yes.
light for us. I'll be brief because you've already heard too much from me, but I'll give you two observations that scream out at you. And this is a little bit, if not a lot, consistent with what Vivek was just saying. We know what the answer is. This is not doctoral calculus. It's there. It's in our midst. The question is, can we execute and bring that care to the point of attack, as opposed to the question of, well, I'm not sure how we deal with this. That's one. Again, I'm an amateur in this respect, but that's one big observation I'd give you. The second one is the stigma associated with this. Mental health versus physical health is jaw-dropping still, and we're all collectively doing our best to close that gap, whether it's the insurance and their approach, and that's going to be accessibility and affordability is our next pillar, which Gretchen's going to host us for in Detroit, or whether it's just sort of the sense you get from your peers. Oh, he or she has a mental health challenge, and it's sort of, as opposed to he or she broke their ankle in a basketball game. It's a sort of yawning gap, and I think we need all of us, and I think everyone here is committed to that, but we need all of us to do everything we can to shrink that gap.
Thank you so much. I appreciate that. So if you have time for one more question, sir, I wanted to ask you, Dr. Murthy, at the federal level, can you share with us a little bit about what the federal level, folks are doing at the federal level to help put states in the driver's seat on issues of youth mental health? And we're going to turn a little bit to talk about maternal and infant health, which we know is one of the First Lady's key initiatives. And so how can partnerships between the feds and the states also reinforce and support the governor's momentum around the initiatives that he shared?
Well, it's a great question, and there's no question at all that states have to have the support, the resources, and the flexibility they need in order to drive towards solutions on mental health. You know your states best as governors, and you know that solutions in one state are going to vary from what's needed in another state, and we need to be able to tailor there. But there are three things in particular I think the federal government can help provide, which I think we have made good progress on. One is funding. And we know from a resource perspective that we have seen an unprecedented amount of investment in the last couple of years, billions of dollars collectively that have gone towards expanding certified community behavioral health centers, that have gone toward investing and expanding in school-based mental health programs, that have established and expanded the 988 services, the emergency crisis line that we spoke about earlier today. And that are also going toward now expanding the workforce, the mental health workforce, which is so important. So funding is critical, but the second area is actually authorities. We know that when the federal government acts to, for example, make telemedicine authorities, to extend them or make them more permanent, that helps. And in the recent omnibus that was passed at the end of last year, there was a 2-year extension added to those telemedicine authorities. I think we've got to do more to continue to ensure that telemedicine is always available as a tool that people can use to access healthcare. I would also put in this category of authorities the mental health parity law, making that stronger, which is a priority for the president as well, so that people aren't discriminated against when they try to seek out mental health care compared to physical health care. And the third area is roadmaps. So when the federal government can help by providing a common roadmap that states can use. That's not to say they have to hew to every single element of it, but that they can use as a starting point. When we issued the Youth Mental Health Advisory from my office in December 2021, that was one example of a roadmap. The federal government has laid out roadmaps for addressing veterans' health, in particular the suicide crisis among veterans, and mental health more broadly. So these are three areas where the federal government can help. But the partnership is really essential because One thing that I worry about is that if we only put money in and expand authorities but do nothing else, we won't solve the problem. We need to be able to learn from what's happening in different states, bring that learning together in a community of practice, and use it to help people in communities across America who are looking to address the mental health needs of their communities. I'll finally say one last thing, which is that when we think about mental health, I know it's easy to think strictly about the traditional contours of depression and anxiety, what we see about in the news, what we read about in the paper. But there's one other very underappreciated but powerful aspect of mental health that I want to touch on that I think is important for us to keep in mind too, which is social connection. It turns out when people struggle with loneliness and isolation, that increases their risk for depression and anxiety. And right now, depending on the survey you look at, nearly a third to a half of Americans are actually struggling with loneliness. And the numbers are highest among children, who we think are the most connected by technology. But it turns out that that's not necessarily the case. And so when we look to address mental health in America, my belief is that we will not be able to ultimately do this effectively if we are not helping rebuild the social fabric of our country. There were times in the past where we were more deeply connected as a country, but a lot of things have happened in recent decades that have reduced the opportunities that people have to gather with one another, that have reduced the quality of social connections, that have replaced high-quality relationships with lower-quality connections online. And we are seeing the results of that right now. And this is one of the reasons that my office in the months ahead will be launching a broader initiative around rebuilding social connection and community in America, because we have to rebuild our sense of connection to one another. If we can't do that, it doesn't just impact our mental health, but it turns out it has an impact on our physical health. Yes. Loneliness increases the risk of cardiovascular disease, yes, sudden death, as well as dementia. Yes. And it also impacts how our kids perform in school, people's productivity in the workplace, and people's likelihood of engaging from a civic perspective. So the health of society is dependent on the health of our relationships. Yes. And so that's why my hope is we can also think about rebuilding social connection as a key part of what we do to advance mental health in America.
Thank you so much. I'm so grateful for that response. Yes. So, First Lady Murphy, I want to turn to you a little bit, and would love to hear a little bit about your thoughts on the issue you've chosen of maternal and child health. What kinds of things have you learned since starting this work?
Thank you so much. Thank you all for taking an interest in this. I think probably just to give you the big picture, you should know, if you don't already, that the United States is 55th in the world for maternal mortality rates. 55th. And once you understand that and you dig a little bit below the surface, you'll find that the inequities are vast. So if you are a black woman in the United States, your chances of dying from maternity-related complications are 5 times greater than that of a white woman. Yep. And if you are an indigenous woman, then your chances of dying are slightly less, but nonetheless multiples of that of a white woman. That's not right, and of those deaths, we found that 80% are preventable. So, akin to the mental health crisis, we know we can fix this if we focus on it. Much like the mental health initiative that Phil has brought to the fore, I also have organized our gatherings along 4 pillars. So in Salt Lake City, we worked on centering women's voices. Dr. Besser loves that, I know, bringing women to the fore and bringing their lived experiences to the table. We are working on access to data and using that data, because historically we have not really focused on the data and making sure that we make decisions based on that information. Our next gathering that we will have in Detroit, thank you, Gretchen, is going to be looking at how we expand access to quality of care. And then finally, our last pillar is looking at how we can embrace innovative platforms and programs to make sure that we are really solving this crisis. So I think what I would say to you is, having worked in this space for going into 6 years now, We have gone around the state listening and learning. We have gone around the country. There's nothing new. It's all the same. We're all struggling with the same challenges. And the best part is getting some of these lived experiences, these incredible experts around the country, and hearing their stories and having them share their experiences in front of the policymakers at the state level. It's been invaluable, and I know that we're really looking forward to what we will produce come July with the actual blueprint, so that anyone who would like to take up the challenge and try and fix this in their own backyard is able to do that.
Thank you. Thank you so much. I appreciate that. So, Dr. Besser, I want to pick up on this theme from the First Lady. When you think about the work of RWJF, and we all know you are very well known at that organization for advancing health equity, can you speak a little bit about how states are working, in your experience, on working on, to reduce disparities in maternal mortality?
Yeah. Well, thank you for that question and for the opportunity to join you here today. The First Lady's initiative is so critically important. We have shared values in our country in that we believe everyone in America should have a fair and just opportunity for health and well-being. And when you think about that in the context of maternal health, what we believe is that every pregnant person in our country should have a fair opportunity to have a healthy pregnancy, a healthy baby, and a family that thrives. And the statistics that the First Lady laid out indicate that's not the case. And you can think about that and be totally despondent and say there's nothing that we can do. And then you look around the country and you see all kinds of things that are taking place that are having an impact on that. So you see 38 states that have extended Medicaid benefits to women following pregnancy for the whole first year of their child's life. That saves lives. We see states that are increasing the minimum wage to $15. And you may wonder, what does that have to do with maternal health? Well, how healthy you are when you become pregnant has a big impact on your pregnancy. And if you don't have enough income to buy healthy food, there's no way you're going to have a healthy pregnancy. We see states that are licensing and providing reimbursement for birth attendants, doulas, and other traditional birth attendants. And we know from many, many studies the impact that has, in particular for women of color. And then you look at the question of data. And every single state has an expert panel that is their job is to review every maternal mortality in the state and look at the cause. And if you dive into that data and you break that data down and look to see where are their problems, it points to solutions and changes. And it's going to vary by community, it may vary by race, by ethnicity, but if you use the data that you already have, you can have a big impact on a problem that just seems unapproachable. And what I love about this initiative is it's pointing the way to something that is to a change that every single state could make.
Thank you so much. Thank you so much for that. So, Reina, I want to turn to you and ask you briefly. You have a unique perspective as a young person here. We're all young, I'm going to say that first, but as a young person here, you have a very unique perspective that, it's very important to all of us here, right? We're all touched, as the governor of Utah said, we're all touched in some way by the crisis that is facing our young people. And so from your perspective, can you enlighten us, because you're the expert, what are our young people today struggling with when it comes to their mental health? It's been a concern for decades, but there's something unique about what you all are dealing with today. And before you answer, I'm just going to shout out my daughter, who's an 18-year-old, who's over there in the audience. Morgan, wave. Nobody can see you, but wave over there, Morgan.
Stand up, please.
You see, stand up, Morgan.
Hey, Morgan. Morgan, you want to come up and join us?
I know, she probably doesn't.
Okay.
So if you are rising, she's going to my alma mater, Howard University student, go HU,
I love
Bison.
that. All right.
But Reina, could you enlighten us a little bit, because your perspective is deeply important.
Yeah, thank you so much for the question, and thank you so much for having me here, able to share my experiences with you today. I would definitely say that I think a big misconception about my generation, because we are the so-called digital generation, Gen Z, is that the isolation for COVID would have less of a disruption on my generation as a whole as opposed to other generations, because 95% of our communication was already done through social media. And I honestly thought that too going into it, except I realized as I was going through it that we still are social beings as teenagers, and we still crave that in-person interaction. And yes, while social media is great for maintaining relationships, yes, you can also start new relationships, but they're very surface level. And you crave that deeper connection, and that deeper connection you can kind of only get through an in-person interaction. And I think that, in addition, social media, when you're in quarantine, can also become very toxic to an extent. If you're sitting in your room by yourself and you're just scrolling through your TikTok For You page, for example, you can absorb a lot of toxic content without even realizing it. And when you come across a video that has 4 million likes and 10 million views, you think like, oh, this is probably something that I should look at and think about. And it's a diet trend, like new diet that's promoting a 500-calorie week. And you shouldn't really think about it, but because there's no one there to kind of say like, no, Reina, that's stupid, don't look at that video. You kind of just absorb the content without even realizing it. And it's just kind of a toxic trend. And additionally, I think social media also just exaggerates the kind of you're not good enough rhetoric. There's constantly the you're not attractive enough, you're not intelligent enough, you're not special enough, kind of all of that through posts from your friends or through influencers or through just general acquaintances, and that's all at the palm of your hand at all the waking hours of the day through your phone. So I just think that the biggest things, obviously COVID exacerbated a lot of mental health symptoms for youth, but also social media as a whole, and before COVID even came along, I think was just, it can be toxic if used to an extreme extent.
Thank you so much, Reina. We appreciate that, and we receive that, and we hear that. So it feels like having supports for young people to help them cope with some of this toxicity that's coming at them is a really important issue that we need to take with us when we leave. All right, so I really appreciate that. So I want to turn back to you, Governor Murphy and First Lady Murphy, and I would love to hear a little bit from each of you about being partway through your initiatives. Governor Murphy in particular, we've heard 2 of your pillars that you've already enacted, and you're going to be working on those 2 more pillars through the end of the year. What are you most excited about upcoming related to your initiative?
That's a good question. First of all, I have to say, Vivek and Rich, I should have said this up front, in the deepest, darkest moments of the pandemic were incredible resources for us in Jersey, and I think for many states here. So Rich, I want to thank you, and Vivek in absentia. Second observation I want to make, which ties Reina with Rich, is Rich called me up when we launched this initiative, and he said, "Let me just tell you one thing, Murphy. You better have lived experience represented in all of your panels and discussions." So my Brianna Keys and Laura Consul on my team will know the phrase that I use. If we don't have lived experience on a panel, Rich Besser will throw me out the window. So I just want to say that in public. So Reina, thank you so much for being here. And by the way, she took a red eye in from the West Coast to be here this morning.
Thank you, Reina. Thank you.
So the 2 pillars that are left is 1, affordability and accessibility, under the theory that no matter how good a whiz-bang solution we come up with, it won't matter if people can't find it or afford it.
That's right.
And then coach the coaches is the last one. How do we make parents, educators, folks who are at the front lines with our kids, how do we get them to punch at their weight in terms of spotting mental health challenges and knowing where to go with our kids? The thing that's most exciting to me, and I'll be brief here, is we're going to have a playbook by next July, both on maternal and infant health and strengthening youth mental health. I'm not suggesting that we'll have all the answers necessarily, but we will have a comprehensive playbook for American states, I would argue perhaps for the federal government as well, for local communities to take off the shelf and apply to their particular situation. And that really, if in fact we get there, and we will, that really, really excites me.
Thank you so much. And First Lady Murphy, how about you? What are you looking forward to?
Listen, I would underscore the playbook is really what I'm looking forward to. But, you know, I'm looking forward to not talking about this topic anymore. I'm looking forward to our getting on the other side of the playbook and actually implementing all of the best practices that are being unearthed from across the United States and the actual ways we know we can absolutely eradicate this scourge in our society. And I would say that individual states have great solutions, and they're really exciting when you hear about them. I know Phil already talked about things that are going on in Colorado and things that are going on in Utah. But you know, I know in New Jersey, there's one thing that we're working on right now, which is universal nurse home visitation. In the first 6 weeks of a baby's life, a baby is seen by a doctor multiple times, and a mother is never seen. And then if the mother is seen, and 6 weeks later, the mom may put on her Sunday finest and take 5 buses and end up in a white, you know, painted doctor's office. Doctor has no idea. It took her, you know, 3 hours to get there. You know, has 5 kids who she's leaving aside. Doesn't know. With universal nurse home visitation, you eradicate the stigma, because whether you are a multimillionaire or you're getting WIC and SNAP, it doesn't matter. Everyone is entitled to have a nurse visit, a certified nurse visit in their home within 2 weeks of delivering a baby. And that means that there is a nurse who can go in and see the mother and see the child and see the surroundings and not be invasive, but make suggestions and connect resources. That is really exciting. And there's so many of these things that are going on all across the United States, and I'm really excited to put them into the playbook and to make sure that everyone has access to this information.
May I just say one other thing, Alfiee, if I may? There was this, somebody had the expression, 80% of life is showing up. I'm not sure it's 80%, but there's really good stuff going on in both of these fields across America. And a lot of this is sharing best practices of stuff that already exists. Like Safe UT, in Spencer's case, that's a game changer that is going to be part of our playbook. So that's, to me, that's kind of both, I'm forlorn by that because, well, gosh, the stuff's happening out there. Why aren't you already doing it? But it also gives me a great sense of optimism that that's not that hard to just rip a page out of somebody else's playbook.
Yes, I appreciate that, definitely. And as a Black woman, First Lady, you know, who understands that there are issues that have nothing to do with socioeconomic status when it comes to maternal health, right? So whether you're the wealthiest Black woman or not the wealthiest Black woman, you're still going to have these maternal health issues. So knowing that you're doing this is very heartwarming to me and very important because it saves lives. So I appreciate that.
I just would say to that, Serena Williams, Beyonce, I mean, these women nearly died, and if they can't get their voices heard, who can?
That's exactly right. Thank you so much for that. Yes, yes. So Dr. Besser and Reina, we're going to have you help us close out this segment, and then we're going to pivot to some questions from our incredible group of governors here. But one thing I wanted to ask you, Dr. Besser, is, you know, being a person who runs a nonprofit, you know, money is a thing, so we got to have money to do the work. And we know that philanthropy is a major partner, not just as a funder. So it's not just about giving money, it is also about holding hands and doing the work together. And in policy. So can you describe a little bit for us, from your perspective, what a strong partnership looks like between the public sector and philanthropy in doing this work?
Yeah. Well, thanks for that question. We are the largest health funder in the United States among philanthropies, but we don't see our role as replacing the government. The government has fundamental things to do. What we can do, though, is some things that it's harder for government to do. We can invest in novel ideas and try things and support efforts around the country that are trying something new. We can support those in states so that they can learn from each other. So for instance, we support a Medicaid Directors Institute that trains new Medicaid directors, because those positions are hard and they turn over a lot. And so training people is important. We support a network of Medicaid directors so that each of your Medicaid directors has the opportunity to learn from what's going on in other states and doesn't have to reinvent the wheel. And that way innovations are more likely to be picked up sooner. We do a lot in the policy arena. And there it's trying to help identify what are some of the best policies to remove the barriers to health. Because if we spend all of our time on the treatment end, and we don't invest in changing society, removing barriers so that everyone can have a fair and just opportunity, we're never going to get to the nation that we all want to see. And philanthropy has that opportunity. And our grantees work in every one of your states. And what they can do as well is help connect to people in community. Because a government that isn't hearing community voices, a government that isn't hearing the solutions that people in community know, and is not responding by working to implement those community-driven solutions, that government's not going to be effective and is not going to be seen by people across the country as meeting their needs. And philanthropy plays an important role there. And then lastly, one of the things we focus on is narrative, and the narrative around who in America is worthy, who is worthy of leading a healthy life. And that's a fundamental question that we have to ask, because as a value in our nation, we believe that everyone should have that, but we're not living that, and we can help us get there.
Thank you so much for that. I really appreciate that. And I think about it from the perspective of, and then I'm going to turn to you, Reina, with one last question. From the perspective of, one of the things that philanthropy does that you have the capacity to do is to support entities and organizations that otherwise might not have access to funding or support or partnership or mentoring to do the work that they do. We talk a lot about the AAKOMA project, what we call practice-based evidence. People who are out there doing the work, but maybe they don't have the evidence base behind them. And so what you all are able to do in your work is to help them build that research and build that evidence so that they can spread those best practices around to other folks. So thank you for that. So Reina, I'm going to end with you, and then we're going to turn to our governors. Could you share a little bit about why it's important, right? Our Governor Murthy also mentioned this earlier. Why is it important for us to hear the voices of young people and people with lived experience, number one? And then two, what are some great ways you've seen people do this in your experience?
Yeah, so thank you for the question. I think when I think about my treatment experience, I can pinpoint several moments where I received treatment from professionals that was not only unproductive but harmful to me at the time. When I was first hospitalized, I waited in the emergency department for about 3 days on suicide watch, and basically they just watch you eat, sleep, walk you to the bathroom, walk you back. They literally watched me play cards with my mom in case something were to happen. And to say the least, it was the most dehumanizing experience I think I've had to experience, and definitely not productive for me going through that crisis. And I didn't receive any treatment at the time in the emergency department. Then when I was finally able to get a bed, an arguably worse experience when I was having my intake assessment. He was doing the nurse was asking the basic questions: where are you from? What school did you go to? I said the National Cathedral School, and he looks at me up and down and he says, how could a happy-go-lucky girl like yourself possibly ever want to kill herself? And in that moment, I don't remember what I said. It's not important. I think I was just too stunned to speak, but I definitely just felt so invalidated, and that is probably the last thing I needed to hear in that moment. And I think that's a perfect example of why we need to listen to the youth voices and perspectives when making policies, because you really hear the patient's view of what is going to be productive treatment for them and what's going to be the most helpful treatment for them. Because in that first experience, waiting in the emergency department and then having a negative experience with the intake assessment, those were both very just harmful situations. And I think governors can really help this by not only educating, but also just like listening to youth voices, really incorporating their ideas, really seeing what they think is best for their peers and for themselves, and just really getting that patient perspective.
Oh, thank you so much, Reina. And I'm going to turn it to the governors in just one second, but I want to pick up on what you said and say that your experience, I'm sorry that you had that experience. You should not have had that experience. Thank you for being so transparent and open with us, because it's not easy to sit in a room with all these folks and share that. So I want to honor that and appreciate that. And I think at the AAKOMA, yes. And two things that you shared that really, you talked about, this is what I took from it, that allowing young people the space to lead. So at the AAKOMA project, we have something called Team AAKOMA, which is our youth leaders and advisors. So I'm going to pitch you to come be part of Team AAKOMA, because we really need your voice. And then secondly, it is really understanding. How do we understand? Sometimes it's through collecting data. And so we have this great report, the State of Mental Health of Youth of Color specifically, a relatively equitable sample of youth of different racial ethnic groups, where they talk about the kinds of things that you just described, what their experiences are in accessing care, what their experiences are in dealing with their mental health. So I would encourage people to look at that at the AAKOMAproject.org website. So now I'm going to turn it to our governors, and I understand Governor Whitmer, you have a question or a comment, and then after you speak, if there are other questions or comments, we would love to open the floor. Please go ahead, Governor.
Well, thank you. I appreciate all the comments here this morning and how important this work is. You know, Governor Murphy, I want to thank you and First Lady Tammy Murphy for championing two of the most, I think, important issues that are facing our country, and it's mental health and it's maternal and infant health. Just this week, and I know many of my colleagues are introducing budgets right now, but you know, recognizing the importance of these issues, we included critical resources for youth mental health in and outside of school, as well as additional resources for our effort we call Healthy Moms and Healthy Babies in Michigan. And I look forward to sharing more with you when you come to Detroit in a few months. We're really focused on improving maternal and infant health outcomes, recognizing the disparities that you, Tammy, gave voice to earlier. And so I just am excited to host the Chairs Initiative Roundtable in Detroit, and want to make sure all of my colleagues know that we'd love to host you and show you a great time in Detroit as we work to tackle this issue that so many of us are focused on across the country. So thank you.
Thank you.
Thanks for
you
hosting
so
us.
Much. Yes, we appreciate
Go
it.
Tigers.
So other comments or questions? Yeah, back here in the corner. I saw your hand first. I'm so sorry.
Hey, thank you. So my name is Josh Green. I'm a new governor, but I'm an ER doc. So thank you for sharing your story. I just wanted to observe that historically, behavioral health is lowest reimbursed, right? And I've watched this for decades now, even in our own state, where our adolescent health team ended up shutting down on Maui, and it was the only service we had. So now every adolescent has to be transferred, which again is one of the worst imaginable things, to be away from your peers, away from your family. And so I would just observe that we as governors and we as a nation have to completely change our approach to healthcare, because until we fund and reimburse, like Gretchen shared, better this part of healthcare, we won't attract enough social workers, we won't attract psychologists, psychiatrists, we just won't see real change. And to the First Lady's point, we don't want to be talking about this again 5 and 10 years out. So I think we have to make that commitment, because our adolescents are dying of suicide, they're not dying of heart disease. Our adolescents and their families are suffering because of this lack of commitment to behavioral health, which is now so prevalent after the COVID era that it is primary care now. And so I hope that we will view this as primary care and convince the medical institutions and everybody across the country that this has to be the focus. We'll be a better country if we make that change. So thank you for letting me share.
Thank you so much. So I saw...
Greg is Governor
Okay.
Gianforte here.
Yeah, go ahead.
Yeah, thank you so much, Governor Murphy and Doctor, for this panel. It's an incredibly important topic in Montana. We're in the process. We've made a commitment to a generational commitment to behavioral health, a $300 million fund that'll bring back community-based mental health. And when I was in Congress, I was very pleased to carry the bill that enabled the 988 suicide hotline, so that was also a piece of progress. But my question is for Ms. Chiang. Thank you for being here and enduring the red eye to be with us. You mentioned that social media can be toxic and have a negative impact on people that are consumed by it. How do we make it less toxic?
Great question.
Yes.
Yeah, it's a great question. I think that a big part of social media that makes it so toxic is the idea of algorithms and curated content. I think curated content is specific to you. It's very personal, obviously, and it's meant to keep you scrolling. It's meant to draw your attention. It's meant to relate to you. And I think that's not necessarily the healthiest in terms of also algorithms, right? It's just to get more views on videos, but also videos that can be curated to you. I just think maybe less curated content, less user-specific content, and while I understand that that may get less views on things, it's better mentally for people because then they're not going down a rabbit hole of just toxic video after toxic video after toxic video because that's what they've been previously viewing. They get a more widespread, different kinds of videos that they can look at, and then their algorithm isn't necessarily stuck at one thing.
Thank you.
That makes sense.
Thank you so much, Reina.
question.
Appreciate it. So we probably have two more questions.
Governor Moore down
Governor Moore, and then can we go back over here?
Absolutely.
Okay.
Thank you so much, and thank you for this conversation. Thank you for your leadership on this, and Reina, thank you for your vulnerability. This is not simple. This is not easy, and we just want to let you know that we appreciate you deeply, and so everybody up here, just thank you for this. We've like Governor Green, I'm now 20 days into a governorship. And 20
How's it going so far?
Going well so far. Going well so far. But you know, but and I tell you, Governor, it's this issue is a core priority for our administration, both in terms of how we're thinking about the funding. Also, you know, we've developed this, you know, the Adverse Childhood Experience database, the ACE database, that we want to get a better understanding where all of our children are and what they're dealing with. But the question I have is about trauma. The level of trauma that our children continue to see and feel in their everyday lives, it means that we have to be aggressive and thoughtful and deliberate about the type of supports that we have on base. You know, before I ran for governor, I was in the military and, you know, deployed. I was with the 82nd Airborne Division in Afghanistan. And the military has evolved over the years as to how we dealt with redeployment, how we supported soldiers, sailors, airmen, and Marines, et cetera, when they came back home. But that was a process. And the process looks very different now than it did, for example, when I deployed in 2005 and 2006. So as governors, how can we think about the issue of trauma, particularly when it comes to the high level, intense level things like gun violence and the opioid addictions that our children continue to deal with? And how can we actually make sure we're having targeted supports for the fact that our children are dealing with so much, and oftentimes they feel like they're dealing with it alone?
Oh my God, that's a
Great
powerful question. So I will turn it to some of my colleagues, and I can chime in at the end. Go right ahead.
Rich,
anybody?
Rich, you.
I'm a general pediatrician and have spent my career working in community clinics. And so I would see so many children who'd experienced trauma. And I think it's absolutely critical that we provide support, that we make behavioral health an area where it is being reimbursed in a way that there is an increasing pipeline. But if that's the primary focus, we're never going to get ahead of this. You know, all of those issues that you lifted up that are causing the trauma are changeable. And if we don't move further upstream and address those issues, we're never going to get there. And we're going to continue to see the horrendous statistics in terms of suicide, in terms of mental health. But you know, everyone should be born into a family where they have the opportunity to thrive. And there's something that can be done in every single state to make that more of a reality.
Thank you so much. So I'm going to answer quickly, and then the governor, I can close this session out because I'm going to yield to the governor because he's the governor. And what I would add is, again, this idea of talking to people with lived experience, talking to people who know practice-based evidence, people who are out there doing the work, actually, who can be very informative in terms of what they share with us about what's important and what best practices are. I think talking to people, you know, broadening our lens about who we identify as an expert. Right? There are lots of folks who are experts who don't have alphabet soup behind their name, but there's lots of diversity in terms of who we think of as experts who do have alphabet soup behind their name. And I think finally what's really important to me is we have to name the reality of people's experiences with different kinds of trauma. Right? So you talked about military veterans. There's also this thing called racial trauma. That's a real thing. Right? So we have to be open to having those conversations. Gender-based trauma, LGBTQIA+, folks who can also be of different racial ethnic groups. So I think it really is about recognizing, identifying, and labeling all the different kinds of trauma that are out there, talking to the experts, and looking for practice-based evidence. And since I'm local, you can certainly count on me, Governor Moore, to be supportive. So with that, Governor Murphy, would you like to have the last word?
I would. One of the things of many that I love about Dr. Alfiee is she brings this panel to a close like a German train.
I was told.
Exactly on time, man. That was impressive. Listen, to you, to Rich, to Reina, to Tammy, and Vivek in absentia, God bless you, and really impressed. Thank you for your
Thank you. Thank you.